interest of time, we're going to go straight into the next panel. As you heard, and we have 3 speakers, and what we decided to try and do is we let each speaker talk for 5 or 10 minutes to illustrate or showcase some of the work that's being done with these things, and then we will open it up for questions.
Good morning, ladies and gentlemen. This morning, I'd like to introduce my new technology to treat the patient using cell seed. And if we go back to the culture system, after we culturize cells, we like to utilize cells to treat the patient. But after we treat cells by trypsin dispace, always enzyme disrupt the important membrane proteins. Therefore, after we harvest the cells, cell lost important membrane proteins. Therefore, reduce the cell function dramatically and very difficult to transplant cells. So I invented interesting cell intelligent surface, hydrophobic at 37 degree. Hydration takes place by reducing temperature. You can see surface become hydrophilic at the lower temperature, 37 hydrophobic again. So when we see the cells start to grow on the surface, and we can make confluent cell seed. Just to reduce the temperature, surface become hydrophilic, and the water penetrate into interface between cell seed and the surface. Then we can harvest the cell seed nicely. And the important this cell seed is we can maintain adhesive protein one side of cell seed. Therefore, easily we can transplant. And first, we treated the cornea stem cell deficient disease, epithelium disease. After patient got alkali injury or side effect of drug, after they lost the stem cell from cornea, conjunctiva start to cover all over the surface. Then patient lost the sight. We characterize patient on oral mucosal cells from 2 millimeter cells. We can characterize at 37 and 2 weeks. And we take out this culture dish and change the temperature 37 to 20 degrees. Cells start to detach from the surface. We are using like this donuts type of support membrane, and which prevent the shrinkage of cell seed and assist the manipulation of cell seed. We can pull and harvest the cell seed like this. And important point is, I already explained you, we can maintain fibronectin laminin 5, one side of cell seed. So 2000, we start treat the patient. This is the first patient. We remove the conjunctiva by surgery, and we characterize the patient on oral mucosal cell seed, and put on the eye, and without sewing, cell seed stick to the surface. Within 5 to 10 minutes, they stick to the surface. Then we remove the support membrane, then finish. We published one article 2004 in the New England Journal of Medicine to follow the 4 patients 1.5 years. And this is very effective. And you can see opaque cornea become very transparent. We already treated 30 patients in Japan and 25 patients in France. This is esophagus. We can remove the esophagus cancer and by using endoscopic submucosal dissection. And after we remove the large part of cancer, we always observe the stricture, stenosis take place. And we transplant patient on oral mucosal cells, which prevent stricture and enhance the cure of surface. And within few days, patient can go back home. Otherwise, when we cut the neck and chest and abdomen, remove the esophagus, a patient has to stay 2 months, 3 months in the hospital. And now we start to collaborate with Karolinska, and we start to treat 7 patients for Barrett. And also this is a very effective method. And the heart, we are making a heart patch from Myoblast. And if we inject a single suspension directly, left side, increase the infant fat little bit, increase the thickness of heart wall, but same number of cell, we make a cell sheet and stick transplant to the heart wall directly, you can see increase the thickness of heart wall. So if we inject the single cell suspension, more than 95% of cell disappeared. And but cell sheet, 100% of cell, they stay there and they release the cytokine continuously and induce the microcapillary in the tissues and enhance the growth of cells. This is the first patient video. This patient is a cardiomyopathy, and we implanted artificial heart, and we tried to find a heart donor, and very difficult in Japan to find a heart donor. And Dr. Sawa, Osaka University, my collaborator, he tried to find heart donor but failed. Finally, he decided to transplant patient on Myoblast cell sheet directly to his heart. And this is a Myoblast cell sheet. We are using a mesh support membrane and transplant to the heart. After cell sheet, stick to the heart. Then we can remove the support membrane and finish. And 3 months later, we have succeeded to remove the artificial heart. And his heart started to move well, and histology show much better than before surgery. And 7 months later, Dr. Sawa permitted him to go back home. Since then, 6 years have passed. He's okay now. Every morning, he's enjoying walking with puppy. And after that, 20 patients we already treated. And currently, Teruo company